During a recent class discussion section, I had an opportunity to visit with two gentlemen. One is a graduate of the Health Informatics program, and another completed this class and is soon to graduate. I asked them three questions. First, to introduce themselves and note what interested them in informatics. Secondly, how would they be applying informatics in their work? And thirdly, how did they survive this class and degree program? So with that, I'll introduce John Beyer, who's a pharmacist at University of Iowa Hospitals and Clinics, and start with question one, or tell me about yourself.
Sure. So I finished the Master's in Health Informatics program 2 years ago, and here's how I got involved in it. It's kind of funny. I was looking for a degree program to do in concurrence with my residency program, and for those of you who are unfamiliar with pharmacy training, so we do our undergraduate experience, then do a 4-year doctorate of pharmacy degree, and then some people will go on and pursue 1 to 2 years of residency training. So I had decided to pursue a 2-year program in administration, and then concurrently with that I can complete a master's degree.
So it's like what?
For informatics, and informatics is sort of a word that most people aren't familiar with until they get into either the health informatics field or into some of the other allied professions that also practice in informatics. But looking at just how we utilize data or utilize information systems in order to accomplish a goal. And so when I was starting my residency experience at the university in town, I went to Drake and did my PharmD and my Master's in Business there. When I came here to start my residency experience, I found that I was a really fantastic place for informatics. And we are at the healthcare campus at the cutting edge of a lot of different initiatives in healthcare that are informatics focused. So I can get into some of those specifically if you have questions about those, but ultimately it's an environment that fosters people who are at least cognizant of informatics, or certainly people who are interested or maybe will pursue that as a career. So with a few mentors over at the university, and then after meeting Nick and Kirk, I decided to pursue the degree program for my second year residency and completed that. And so my current position, I now am the pharmacy informatics manager at the university. So what that position looks like, I have a total of 10 staff now that report up to me. 6 of them are pharmacists, 4 of them are pharmacy technicians, and we maintain medication systems as it relates to Epic, our electronic health record, as well as all of our pharmacy automation, our pharmacy data analytics, all of our kind of ancillary pharmacy systems that are information systems we maintain as well. So in my day-to-day, I get to look at, today, for example, we just on Tuesday implemented a new system that uses gravimetrics and photo capture in order to do remote verification of medication compounding. So we just went live in our cancer center for that. And so that's built on a SQL database that was configured on a Windows server, and this application is actually written in Austrian, so that was something I was less familiar with. My master's didn't really prepare me for that, but so it's...
we'll add a module to this class.
Yeah, we need a language minor or something, but so that's my current day-to-day right now. But on Tuesday I had a data validation visit from one of our accreditors who was talking about how all of our data warehouses are set up and how information is taken out of our electronic health record and put into a data warehouse, and how we query that data warehouse, and how we can validate that data for what we send along to these accreditors. So I guess I'm answering a couple questions on how I use my master's degree, but it's interesting because when you're going through the program, I think a lot of the different topics that you go through are somewhat disjoint. So you're learning about SQL, then maybe you're programming in R, and then all of us take that Python course, and then you have Kirk's course, and we go through these, and I think a lot of it's the onus is on the student to really connect those topics together, and that was an important concept that I took to heart during my program, and it's really cool to see how my career is doing that in and of itself. So I can look back to these different experiences and these different classes that I took, and how when you think about how those can be put together, it makes you a lot more successful at your day-to-day. And at the time when you're like up at 2 in the morning doing your programming or whatever, it's just does not feel as fun, or does not feel as applicable. But take heart, those things will eventually come back to benefit you or haunt you, depending on how you feel about them as you get into your career. And it's clear even in this week that I've been able to do that. So it's been pretty exciting. So ultimately, it's been sort of a whirlwind of things. I don't think anybody really has a great plan for what their future holds. I think if you think you do, it's going to change. But I've been very fortunate that all of my training has kind of culminated into what I'm doing now. So
cool. Thank you. The second speaker is Garrett Larson, completed this course last year. And Garrett, what brought you to informatics, to the University of Iowa, and what will you be doing with this degree?
Okay, Kirk, thanks. I do have some just bullet point slides here. Basically, why am I here at the University of Iowa? Anyone seen this diagram before? It's basically, it's the tire sync diagram from you guys at home. It's the customer envisions this epic product they're going to have, and the project leader says, okay, customer, I'm going to make that product for you. And then the analyst designs the product, and then the programmer does what the analyst told him to do, and then eventually you get something that doesn't even represent a tire swing. And the customer just wanted the tire swing. And so that's kind of brings me to why am I here? So I am a United States military, U.S. Army officer, currently serving active duty. I've been in for about 15 years. And the DoD just signed a massive contract with Cerner to implement the largest transition of medical records ever in the history of the United States. And as part of that, we're starting to get some clinicians trained into health informatics. So we can go back and start spreading health informatics. That's a buzzword among us at the DoD, health informatics. Spreading health informatics to the masses. And so why did I do that specifically? Back to this here. There's two things here. If I were to click this up, this is an article on the electronic health record here. And again, back. Anyway, it pulls it up and it says that if anybody heard of ZDoggMD, please Google ZDoggMD. Especially you clinicians over there. It'll make you laugh for hours. He's a doctor, internal medicine, just griping about the current state of health. And he's pretty popular among the medical professionals out there. I think he's got close to 1 million followers, and he has a couple of blogs. Anyway, he's really been adamant that the current state of the health record is not really a health record. What we are doing now is we've transitioned our 300 to 600 systems in the hospital into a single thing. And when you go to visit, how many of you had their provider sitting at a computer clicking boxes and such? A few of you maybe? I don't really like to do that. And so what I'm finding now when I see my patients is I'm losing that interaction by the sheer volume of things I need to do in the electronic health system. And so hopefully I can take what I'm doing now and put a clinical spin on the user interface of the electronic health record. That's my ultimate goal. And hopefully bring it back to a health record. So that's what I'd really like to do. And again, back to the, why am I here? The DoD is sponsoring my trip down this lane, and maybe I'll ultimately get to do what I want to do someday. But for right now, who knows what I'll be doing? Because really, I have a little video here, but what is health informatics? Bringing it to my paper that I'm presenting at AMIA, health informatics can be anything. There are literally 300 programs in this country right now offering various health informatics program degrees. You can have a certificate, you can do clinical informatics, you can have a master's, a PhD, a bachelor's degree, and all of them have their own little definition of health informatics. And really what it comes down to is meaningful use and macro. Why are there so many programs out there? Why is their market being flooded with health informatics? How many of you have heard of health informatics prior to maybe 3, 4, 5 years ago? Yeah. And why do we hear about it now? Why do we have a chief informatics pharmacist at a major university hospital? It's money. Where does the money come from? And the money comes from, right now, incentives from the federal government and future payment models, which are no longer going to be incentive-based, but penalty-based if you're not complying with certain technology and certain data requirements that are out there. And so That's really what health informatics is now, based on my research. Now, you can do whatever you want to do. You can build apps. You can do telehealth. You can do pharmacy. You can write computer programs. But bottom line, what my research is showing, what I'm presenting at AMIA is right now the market wants people that can crunch these numbers and submit data so they can get payment from Medicare and CMS and other agencies as part of meaningful use, MACRA, MIPS. You're going to hear so many terms. Don't worry about them all for right now. Just know they're there and get through it. So again, you're going to hear so much stuff. Health informatics, what is it? It's crazy. And Kirk is going to fill your heads with so much stuff, you're not going to remember it all, I promise you. You know, I've tried. In fact, I'll show you here in a little bit, I created a blog just to kind of wrap myself around it, and by the end of 1 year, I just have links to everywhere. I had drop-down files, and it's a mess. It's all there still, and I'm going to slowly transition it to a database type of platform, which is a little bit easier to manage, but there's just a lot out there. And so brings me to public health informatics at the University of Iowa. You know, why are we here today in this class? You know, you guys are taking public health informatics. The bottom line, you know, one of your questions you're going to get to, I think here, Kirk, is why you should be in this class. You know, who's taking this class as a requirement of their degree? So, I mean, you don't graduate if you don't take this class. Is that pretty much everybody, or is there some that are taking this for fun? Who's taking this for fun?
It's an elective for, yeah.
Okay, what program is that?
Business analytics.
Awesome. Okay. And I'm taking a database course right now over in the business school that is analytic based, and I think there's a good merge there, and I actually believe there's a graduate from the health informatics program working over in the business school doing health data analytics. So if you have the opportunity to take that course, I'd recommend it.
Todd Papke.
Yeah. But for the rest of you, you're required to take this course, so try to get something out of it. And we'll talk about final papers and things like that when you want to, Kirk. But I threw this up here because, you know, you got a great instructor here who has a life outside of health informatics, and all of you can have life outside of health informatics and school. And so I just wanted to throw that out there. And what else I got here? So I got, you know, we can chat about some things. You know, here's what I can talk about. Certainly don't throw any statistics questions from my way. You know, there is a requirement in our curriculum to take a statistics class. I took it. That's done. And then the last thing I want to throw out is, let's go back here. You know, have fun with your degree. Again, a lot of you are taking this as a requirement of it. If you're not, there's elective. Who's got electives in their curriculum? They can take kind of whatever they want for fun.
We have some.
Yep, good. You know, I took basically a geospatial map making class just because I thought it would be fun to do maps. It was. I learned a lot about maps. And for a final project, I planned my summer vacation using the traveling salesman problem routine, you know. That was the justification for it. And I did this great user interface map app that you could do with my phone, and I could chart all the progress, and I could get our directions. I could see weather radar, and you know, created a lot of great maps. But you know, my recommendation is just have fun with your curriculum here, and every once in a while do something that you want to do for yourself. And then whatever else, Kirk, you want to talk about. Again, I can get on the final project if you want. I want to throw some examples on there if you want.
Yeah. The point of this presentation is to see real people, that why they came and what they will do with this work. And I think each of you are forming that in your own minds. And that the third thing we'll talk about is how to survive in this class. But for now, I'd like to open it up to questions. So please ask questions. unlike the silence that we often deal with in the first half of this class. We have a pharmacist, we have a clinician, he has a clinical practice also in balancing his daily work, and all three of us are informaticists. What's on your mind to clarify what they've done, what they'll be doing, and maybe reflect upon what you'll be doing with this work? Fire off any questions you might have.
How did you guys best leverage what you learned in this course, or like a specific example of
And repeat the question.
implementing
please.
something from this course?
John?
Repeat it out loud.
Yeah.
So how do we best leverage things that we've learned in this course to, I guess, our current, whatever we're doing currently?
Right.
So actually one of my favorite ways that I use this course is, so I take students on rotation and residents on rotation, and I always pull your slides to do my public health discussion.
Mhm.
So I go through a public health informatics discussion, so that's been fun because I can steal a lot of his content. But actually one of my favorite applications for it is one of the things that Kirk had showed us was looking at doing mapping visualization and using different tools out online that can look at like the incidence of different infections, or being able to see and kind of visualize the impact of informatics on public health. And one of the tools that we're implementing at the university right now is called Slicer Dicer. It's a way that we're able to do data visualization of the data that's actually located within our Epic system. And so it's been fun to apply some of the concepts that Kirk has taught us about, and making it a really user-friendly interface, or being able to focus on how do we actually parse that data out in a way that's meaningful to users, so that they can visualize that data either on maps, so using zip codes, since we're talking about HIPAA compliant data, but also looking at, how do we group different pieces of information. So from my standpoint, I'm looking at medication use, or diagnoses that relate back to medication use, and working with other teams in order to help develop those tools so that our end users can kind of quickly and intuitively manipulate that data on the fly.
What do you think?
So what I got from this course was kind of the same things. I just want to throw this out here, and you had brought up a lot of the tools and stuff you had showed us, and I actually had a whole section here on public health informatics.
And this is your web blog. This is a website and blog that Garrett created.
Yeah, so I just wanted to show one thing here. So the CDC is a wonderful resource. How many of you have looked how many websites they have? I'll throw that out there. They have hundreds. And they don't update some of them. They update some of them. Others are obsolete. And what Kirk here has done in his course is he's pulled the most pertinent ones and showed them to you. And so you may never use those for 1, 2, 3 years, but there might be a time in 5 years from now where you're like, oh, what was that site? The beef, what were you guys talking about today?
Burfus?
Burfus? Oh, that's right, I need to get some Burfus data. Where was that? How do I find the Burfus data? And so archive that some way so you can have access to it. Let's see here. Does that one say CDC? What? Where's the one that says CDC? Let's see here.
It was the top
This
one.
is the first one.
This one here?
Yep.
All right, what's that say?
CDC, Public Health Gateway.
No, that's not the one I want. And for you playing at home, I'm sorry you can't see this, but I'm trying
You
to.
will.
Let's see here. What's that say?
The next one to the right says CDC Public Health Data.
Right there?
Mm-hmm.
All right. So as you can see, my blog has gotten to be a massive jumbled thing of links because there's just so much out there. And how do you take data, transmute it to information, create knowledge, and then eventually get wisdom is something you're going to have to figure out in your curriculum. And that thing I just said, you're going to see that a lot, by the way. So, and so here's some of the ones that I thought were informative from Kirk's class. And, this is just some. And a lot of them, if you go to the search bar in the CDC, you're not going to find them. And that is just the problem that we have with the bureaucracy of the CMS right now. There's just so much money and so much stuff out there, it's hard to keep it organized. So good luck to you on that. Another thing that I enjoyed from Kirk's class is the writing tool kind of pointing you in the right direction. I don't know if you've showed them the kind of how to write a paper type.
It is a video on the
Yes, I recommend you all watch that
icon site.
and look through that, and just use those tools as a resource if you haven't written significant papers before, because you are going to write a paper in this class, and certainly we can talk about some examples at some point.
Excellent.
If that answers your question.
Additional questions, please. What are your thoughts?
What do you guys think you will be doing in 10 years?
Repeat the question.
Love that.
So the question is, what do we think we'll be doing in 10 years? I think, I don't know if I'll be doing exactly what I'm doing right now. I know that for sure. I think certainly, our systems are going to change, and much of my training kind of postgraduate, after finishing the master's program, is pretty specific to like our system at the U. So it's, these certifications in Epic and our systems that we use for automation and things like that. So I don't think that picture is going to be a lot different. I think Epic, as we know it now, I think I won't ever get away from working with Epic in some capacity, because it's become a part of kind of what I do. But it better look different in 10 years than it does now, because right now it's very much it's a chart made computerized, and that's not going to be a sustainable, usable tool for us once we have that much more health data. I mean, the rate that it's expanding and that we're collecting it on patients, we have to figure out a better way to optimize it. I think if I could be part of that creation process and part of the design process of that system, that would be exciting to me. So either being on a kind of moving out from this role where I sort of sit between a clinician and still being at a hospital and still interfacing with patients and with other clinicians in a multidisciplinary way, but also doing kind of systems design. Could potentially go down the route of doing more of the systems design thing. I think part of me is like, I went to pharmacy school, I still want to be a pharmacist, so it might be moving up and being more in a systems administrator role at a health system, because I think we still need to have people who are clinically minded driving forward those new initiatives. So moving forward the way that we do our system design at a system level or at a health system level, because as soon as we have people who only have a business background or only have an IT background, I think it does a disservice to our patients, because they don't think about that face-to-face patient interaction and the smart forms we have to fill out and the flow sheets we have to fill out, and making sure that your note has all the necessary information to drop a charge and things that like most providers are familiar with. We need to make that more intuitive, and having a clinician in a higher health system role is, I think, is a benefit to us. So I could go either way, but hopefully I still have a job. I think that's really, when you're only 2 years in, you're like, oh, I hope I don't get fired today. You still have those thoughts. So
I want to get to you in a second, but this phrase, a chart made computerized, piques my interest. And in my own mind, I was thinking of almost Maslow's hierarchy. This sounds weird, but those of you in clinical sciences, you start with food and shelter, and then you get clothing, and then you get a little bit better and a little bit better, and at the pinnacle of functioning, you have self-actualization. If you're starting to design an EMR, a chart made computerized, can you apply that analogy or that framework? What do you mean by a chart made computerized, and what is the pinnacle, the best functioning environment and EMR that you can imagine?
Boy, I think so the concept of a chart made computerized in my mind is, right now it's when you access a patient chart, you have tabs that access additional information, which is very much like, if anybody's seen a paper chart, my first rotation as a student, we had patients with paper charts, and so there's tabs, and you flip to the medications tab, or you flip to the notes tab, or to the flow sheets, or the medication administration record. And then within there's more information that pertains to that tab. And Epic looks the same way, Cerner looks the same way. In general, the graphical user interface is similar between all systems. Some more complex than others, or some more intuitive than others, but ultimately it's still non-discrete data stored in a very kind of paper-like way, just it's on a computer screen. And so when we're talking about non-discrete data, a lot of what we're documenting and accessing is in notes form. So it's going to be typewritten text, either generated by hand by somebody typing or using a voice to text software, but we're still translating what a lot of is discrete information into a non-discrete way. And I think we're always going to have some of that because the patient experience and the patient story can never be totally discrete. We understand that. Patients have so many variables, you can't document them all in a discrete way. But how can we actually mine that information into a discrete way? So using natural language processing and machine learning to be able to figure out how to efficiently access that information and use that efficiently. And let's figure out ways that we can predict what the clinician needs at the time that they're caring for the patient. So while we have this wealth of information we store about this patient in notes and labs and medications and flow sheet entries and everything that we've been doing throughout their story, or throughout their epic, that's why it's called epic. You guys didn't know that, that's why they call it that. But so throughout all of that, let's present ideas to the clinician or present recommendations to the clinician based on evidence, on primary literature, and be able to say, hey, there's this factor that you might not have seen. Or like you might be prescribing this, but really there's these studies or a recent study that supports this prescribing practice. And really providing optimal care not only based on the information we have in our system, but pulling in what's in other systems. So doing a conglomeration, a massive data warehouse of information that's all within a shared health record that's potentially one vendor, but ideally shared amongst multiple vendors. So it's less about jumping around a chart and searching through charts and trying to find pieces of information, but more about presenting that in a timely fashion, which we have the concept. It's called clinical decision support, but it's so rudimentary right now. It's all built by people. It's something that a clinician and an IT person need to create to try to present a single scenario with a single set of rules, but it needs to be smarter than that. And so I think a lot of that, if it's more predictive and can be just one step ahead of that clinician in supporting their decisions, I think that we would find that clinicians have more time to interface with their patients, not search through their chart for that lab that they got 3 years ago or what have you. And I think that we would find that would be a health record that supports our workflows and doesn't actually isn't really our primary workflow, which is what it is now. It's getting everything in the record.
Mm-hmm. 10 years from now?
Well, Kirk, first let me add on to that, and I'll keep it simple. I threw an article on there saying exactly the same thing he's talking about here. It first goes into an interaction between a doctor and a patient, and the patient is talking about, hey, I had my colonoscopy many years ago. Can't you see that? Can't you just search colonoscopy? And unfortunately, it doesn't work that way right now. The record is this massive pool of information, and to dive into it is very challenging sometimes when you want a specific piece of information. Everything is in there right now. And again, we're in that problem area of data information and changing that into knowledge and wisdom. And we haven't quite gotten there yet. And
One more question, yeah.
Other than this class, what was the most beneficial class that you took in your health informatics
Repeat the
curriculum?
question.
So what was the most beneficial class other than this one in our
course.
health informatics curriculum? It's funny, like life's really ironic because it was my least favorite class, but for sure my database management class in SQL. And I remember I took my final, so I got food poisoning the night before, and I was like, I have to finish this because I'm not retaking this course again. Like there's absolutely no way I'm gonna miss this final. So like vomiting a few minutes before walking into my final in a crammed room, like sweating, taking this final exam. It's like it just needs to be over. This was like the statistics equivalent for me. And then now like just everything comes back. So like this week, 2 SQL related databases that I have to know and understand and be able to speak to both IT people and my the clinical people in my department about. And it's just funny like describing something that I learned in a class, or like relational database management and relational diagramming. I do that all the time now, and it's funny, this one course that I could not wait to get out of that final exam with my blue book, and now it's a lot of what I do. So just goes to show you, even though you wouldn't think that that's going to be your bread and butter in what your future career might be, and you just are taking it as a requirement, it may be something that you really use every day. And those programming courses, I know I saw some faces when people were talking about Python and Java, and those are really tough. And when you're a clinically trained person, it's not your way of thinking. You don't. something so black and white and something so mathematical is just really, really hard to wrap your mind around, that there's a million ways to get to one solution, but there's only one right solution. It's just really difficult. And like when you think about treating diabetes, there's about 900 ways you could start meds on a patient with diabetes, that not with programming. Either the program works or it doesn't. And so adapting to those things, but seeing that there's going to be value. So just think now when you sit down. I don't know if any of you have taken the database management class. They're real tough, but if you get into my role, or if you work in any health informatics type setting where you're going to be doing anything with systems, it's probably, you're going to hear about SQL again. So it's a pretty big deal, apparently. Didn't know that when I was in the class. So
Your best course?
Well, the best course I've taken, Kirk, first of all, I like this course, the Public Health Informatics course, mainly because Kirk's a funny guy and he's fun to hang out with. So please, spoil him and humor his jokes if you can. We will encourage him to continue, bringing treats and stuff for you. Second of all, the program here at the university is evolving, and informatics in general is evolving. And so courses that I've taken may be different for you, but I will hit on the database course. I'm currently taking the business school data and visual analytics course. It's actually being offered new this year. And it uses, so first half of the course is SQL developer, and we're going to learn all about SQL and database design. But really what I'm excited about is the second half of the course, which is all Tableau, and integrating SQL into Tableau. Who knows what Tableau is? Okay, well you better, because actually my research is showing that if you know Tableau, you're going to get a job. Okay, so Kirk, I think, has mentioned Tableau maybe once or twice already in the course. As a student, you can get the Ultimate Edition for free for 1 year. I would suggest you download that and start playing around with it, watch the YouTube videos, or take a course like the database management course I'm taking that's going to let you do it. Because all these health data websites right now are using Tableau as the kind of graphic user interface bridge between the database and the user. And if you can be experienced in that, I think you'll be beneficial. So I'm looking forward to doing that in the database course. And taking a database course in general just opens your eyes to how this works. And so if you haven't had your eyes opened yet on database structure, you need to do that at some point sooner than later.
We transition to the last question, or the last section. I'm kind of hearing you get at the courses you take in this program to include database management. Thank you for asking about what are your favorite, or what might have prepared you the best. Put together your plan of study with courses, not only the core courses in this program or in your program that you're pursuing your degree in, but design electives around aiming to a purpose. And so let's get to this third area. How do you survive this course? Any tips or tips on surviving the graduate programs at University of Iowa?
Well, your course isn't too bad. I feel like you're giving yourself a bad run. Like,
If people
it's actually like a fun one, yeah. You have to write some papers and it should be interactive. Like, enjoy the interactiveness of this, because that was some feedback I gave you back when I was a student, because it was all online at the time.
Right.
And he's adaptable. You can give him feedback and he'll apply that to his future courses. Like, most professors don't do that. So take advantage of the benefit of somebody who's taking your feedback and reapplying that to make the course better for you. So he's a good guy from that standpoint. I think you want the best experience for your students, and so give feedback, enjoy it while it lasts, because I think a lot of your other courses are going to be a little more dry sometimes, for lack of a better term. This one should be a good one. But I would say one of the most important things that I had to learn was to just step away sometimes. So especially when you're doing anything really computational, it's amazing how you can work on something and like just grind against it for hours and hours and hours. You cannot figure out a solution, and walk away, do something else, do something you enjoy, get your mind off of it. Maybe it's just going to sleep, which I enjoy, and so then you go back and suddenly the solution's really clear, really obvious. And I do that every day in my current job. Is you're working on something and it just doesn't really make sense, or you can't find a solution, or with my staff, they can't find a solution. It just takes some time to walk away, think about something else, and then kind of readdress that problem with a fresh set of eyes. And I think you'll find that things move more expedient for you because of the fact that you're just clearing your head and seeing things differently. But it will be endlessly frustrating at like 2 a.m. in your programming classes. That just happens. I think that's part of you learning to program, you know. But I think you could probably go to bed at 1 and spend an hour on it in the morning, and you'll do better. So
Survival.
Survival. So survival at the university and survival in the program, survival at school. So what's your goal in life? That's what you got to ask. What is your goal after you graduate? Is your goal to be the CEO of a hospital? Is your goal to be a physician, informatics officer? You should start kind of thinking long term. The chief pharmacy informaticist, and start. You know, one of the first things you can do is map out a goal and how do you get to it. And so, my goal is to, you know, be the best I can be. That's vague, right? But you know, to get to that, potentially maybe a professor at a university, you know, maybe the guy that makes the universal healthcare record, you know, helps design that. I don't know. But so you have to kind of design a plan. And who has presented a paper, a poster, or anything like that?
At a national meeting?
Or anywhere?
I'm
Anywhere.
counting a few hands.
Okay.
Good.
So that's
Good.
step one. So step one is to get yourself out there so people see you and know you're trying, because they're never going to hire you for that CEO of the hospital or chief pharmacy informaticist if they haven't seen that you're trying. So some of the things I've done is, you know, I created a website. It's not very good, but I have it. People can look me up and look and see what I'm doing, and they can see I'm trying. I presented a poster downstairs for informatics forum, which I wasn't too interested in, but I did it, and I got the experience of it. People came and saw me, and lo and behold, one of the guys that was there was the some bigwig in Washington D.C. with the health guys. I don't remember what his name was, but he saw my poster and sent me an email like a couple weeks later, and it's like, hey, can I get the information on your project that you're doing, because I want to talk about it a little bit. I was like, okay, sure. I don't remember him very well, but you know, he might remember me someday if he's ever interviewing somebody. And so I wanted to do the next best thing is present a paper at AMIA, which is the biggest informatics conference out there. And so I put a project in, and I did it. I actually hadn't spent too much time on it initially, and then they said, okay, we'll take it, so I better work on it a little bit more, and I had to, you know, do a lot more refining, and then a few months later, the critiques came, and I had to refine it some more, and I'm doing all that, not because I'm going to get something out of it now, but because maybe in the future I'm going to get something out of it. So don't be shy. Like, for instance, coming up is the hackathon in October or November, sometime around there.
Mm-hmm.
You know, if you don't know about anything, at least do that, so somebody's going to see you're trying. So get out there and try, and get yourself known. There's how many students at the university, Kirk?
That's a bad math problem I have.
I don't know,
solved.
15,
Anybody know
20,000?
How many students?
30,000.
30,000 students. How do you make yourself known among 30,000 students? That's your challenge. So make yourself individualized the best you can. So that's the best advice I can give to surviving here at the university. But have fun too. You brought up, you know, programming. Who's taken the Python course? Great. Okay, good. I took that course too. Are you taking it now, or are you?
No.
Okay. Well, I'll tell you, I spent about 40 to 60 hours on my final project, and but I got an A+ on that, and I was very proud of it. And the professor remembered me and gave me a kudos for that. So try your best, and don't be that guy that tells me after I spent 60 hours on my project, hey, can you help me with my project? I haven't started yet. You know, I wanted to help him, but dude, I spent 60 hours on this. I'm not going to do it for you. So, you know, get above all your work, and you know, after this, I'll show you my paper that I did for this class, and you know, you can have it. I don't care. Use it as a template. Kirk has examples. Use them as templates. Get started and do something you like.
I'm truly thankful to John and Garrett for taking the time, sharing their experiences with the course, and I'm sure they'd be available to you for follow-up questions. I also wanted to show the home page on Garrett's blog, which could be a very helpful resource to you. Take particular note of the URL listed at the bottom of the slide, and give him some feedback, give him some ideas, offer some content about how this can work better for students and informaticists out in the field. And most of all, thank you for your interest in public health informatics. Feel free to get in touch with me if you have questions or suggestions about this kind of video work.